In this episode, I answer a question from a massage therapist in Missouri who wants to switch over to a shorter treatment session that focuses on helping chronic pain, but is having trouble getting their clients to be open to a shorter treatment time. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked massage therapists a new treatment method that cuts session times in half and eliminates the frustrations of inconsistent results so they can avoid burnout and help more people get out of pain. Thanks for stopping by and checking out the show. So this week's question came from a massage therapist named Reed from Missouri. They're in year 7 in practice where they focus on injury and pain treatments. The question was, I've been watching your content for a few years and it makes perfect sense to me that doing a shorter treatment time is more effective for those in chronic pain. And I'm all in on working to shorten my session times in my clinic. The problem I'm running into is that the majority of my current clients have been doing longer 90-minute sessions. And when I brought up the idea of a shorter session, they didn't like that one bit and had no desire to change. I know the shorter treatments are the best way to get results for chronic pain sufferers, but how do I help to convince my current clients that I can get better results in less time? Thanks for sending that question in, Reed. And just a reminder, I love doing these episodes. So if you have any questions that you'd like me to answer, send them my way. And if I think I can help, I'll get an episode out to you. The info to submit your question is in our profile or wherever you're consuming this video. So let's get right into it. I've talked about this for years. Why is shorter better for chronic pain? Shorter treatments are better for chronic pain. It's all about treatment dosage. So we make this mistake a lot as manual therapists. We tend to think that all the problems that come in are just like soft tissue related. We don't really consider that there's like damage to the bone, the cartilage, the disc, the tendon. Those are like what's called degeneration in there. And a lot of times when they're in the chronic pain, that's part of the factor as well. So a lot of times those structures can't handle like a really deep and focused, 60, 90-minute session because it just irritates those structures even more. It might feel good when you're doing it, but afterwards it's a lot more beat up, causes more inflammation, and can actually cause the healing process to be limited. Next idea is the idea of like scarcity versus abundance mindset in your practice as you are. We tend to think that the current clients that we have are the only ones we can ever have, but there's lots of people out there that could get help from you. Maybe they're in chronic pain. Maybe they don't have 90 minutes or 60 minutes, or maybe they have 30 minutes, or maybe they just want to get better. There's a whole pool of potential clients out there that just don't even know you exist yet. So we tend to, think the current clients we have are the only ones we'll ever have. There's so much more out there and there's so many more people. Next is you can just already use the built-in trust to educate the client that you have about what you're doing and how you can help. Like they know you, they've been with you for a while. They know what you've learned, how you've grown, and they continue to stick with you. So they're going to trust you. They just don't know. People are like hard and they're creatures of habit and they just think that one way is the only way to do it. But if you educate them and you like tell them about what you're doing and be passionate about it, a lot of them are going to go for it as well. So how we implemented this in other massage therapy practices that have come and worked with us and learned, what we do is we start with a 60-minute initial evaluation where we take like a thorough history, ask questions about what's going on. We do a functional evaluation, palpation, everything like that, and really dial in about what's going on. And then once we establish what's going on, we recommend doing 30-minute follow-up treatments. And that's kind of how we block our schedule off: 60 for an initial, 30 for follow-up. And that really makes the schedule clean, makes it easy to manage. You're not going to like feel overwhelmed and you can focus, but not feel like you're running around with like your head cut off. Then we start with educating and talking about the exciting and new and effective treatment method that you're learning and using. It builds up some intrigue with the clients and they're like starting to get interested about what's going on. Then the next thing we do is we pick 5 people that you like working with, or maybe they've kind of stalled in their results, and offer to give them a full assessment and their first treatment for free. I know you're like, oh, I don't want to work for free, but it gives them a taste and it's good for practice for you. And it's also helping them learn more about what you can do and how you can help. Then any new client that comes in, they automatically go to the 30-minute session. We don't offer 90, 60, whatever. We just offer follow-up treatments and they're 30 minutes. Then we have you get rid of the 90-minute session pretty much as soon as possible and just explain to the clients that, hey, my schedule's too full to be able to accommodate that. And if they want to get angry, they're going to get angry, but most of the time they'll understand. We're going to get rid of the 90 and just go down to 60 to start now so that the ease and the transition isn't as jarring to them, even though it's really not going to be a big deal, but they might think it is. Next is we get to a comfortable number. I like to shoot for about 10 new clients that are on the new shorter treatment session times. And then I set a date where you only be doing the 30-minute sessions. Like you let people know, you give them plenty of heads up. Hey, starting on this date, we're going down just to 30-minute sessions. Then have the talk one-on-one with each one of the clients about why you're doing it and why it's better. Don't just be like, put up some random social media post, be like, I'm going down to 30 minutes. Like talk to them about what you're doing, why you're doing it, what you've learned, and how it can help. And here's the honest truth. You're probably going to lose about 25 to 50% of your current clients, but you've already replaced them with new clients on the new system, the shorter treatment times. It's just going to be better for everyone across the board. Now, and the next question I always get is like pricing. So what do we do? So for new clients, I say whatever you were charging for 60 minutes, now we're going to charge that for the 30-minute follow-up. So it's kind of hard when we think about it, but I try to like kind of break it down. So existing clients, this is what I would do with them. Say they're paying $100 right now for an hour. What I would do in the short term is I charge them 80 for 30 minutes and explain to them that they're still paying less than new clients at the $100 price. And you're showing them you're doing them a favor. They feel like they're special, all that kind of stuff, but it's going to help you actually make more money as you go. So for the initial exam, what I would do is I would charge $200 for the initial exam and I charge $100 for each follow-up as we go. It's clean, it's easy, it's simple pricing. And basically right there is now you went from $100 to $200 an hour without actually having to work any harder. You're just working smarter, as they say. And lastly, and I think this is the most important part, just go all in on this and commit to it and get the practice in life you deserve, all while making some great money and not having to beat your body to absolute hell. That's all I got in the episode. As I close out every episode, go out there and be great this week. The world needs access to your amazing treatment so they can stay the hell away from the traditional medical model of pain pills, injections, and surgeries that only make things worse and ruins people's lives. I appreciate you checking out the show, and I will catch you on the next one.